Mm. Mm. Oh, she didn't get it.
Hello, everyone. Those of you who joined, we just thank you for joining us. We'll get started in just a few minutes. Thanks a lot.
Did you see the beans and the pesto right here on the counter? Did you see those? Okay. If I can bring it. Okay. Mercy! Hurry up, Mercy. They're asking you to come.
All right, everyone. We thank you for joining the webinar today. We thank you for taking part of your evening to learn a little bit about what we have to share with us. Before we begin, just a few housekeeping items. So this session is being recorded. So if you want to, if you don't want your self to be on the video on audio, then please mute yourself and also adjust your video accordingly. Also, this is being live streamed on Facebook, so please be aware of that. We're going to take questions at the end of the discussion. So as we are discussing, please just type your question into the chat and we'll try to get to as many questions as possible. All right. And of course, we all know that this is for educational purposes only. So the information presented here is not designed to diagnose or to treat your individual health concerns. Before you apply any of these things, please speak with your healthcare provider. This program is brought to you, sponsored by 3 different organizations. First is Lifestyle is Medicine. Lifestyle is Medicine is a non-for-profit organization here in Toronto that puts on lifestyle medicine programs for the community. We want to really thank them for being a part. Pathways to Wholeness Lifestyle Medicine Clinic is a lifestyle medicine naturopathic clinic that services the Toronto area. And you can learn more on the website there. Also, we're really pleased that the Western Toronto Korean Seventh-day Adventist Church has sponsored the program. They pay for a lot of the advertising and so forth. And we're just going to give it for the assistant pastor of the church, Travis Guan, to just say a short welcome on behalf of the church. So Travis, Pastor Guan, are you there? Okay, we'll get that after. So today we're going to be talking about autoimmune. Pastor Guan?
Yes, can I go?
Yes, okay, yes.
Okay, thank you, George. So, good evening. Welcome to Dr. George's Health webinar. As a representative of our church, I'm pleased to be a sponsor for this amazing event. Thank you, Dr. George, for planning and organizing it. And much thanks to the speaker today, Dr. Joyce. I'm personally interested in today's topic as well because the importance of the immune system has risen these days for COVID-19. And I think the immune system can be the answer for this kind of pandemics, when especially there is no vaccine yet. Because of these reasons, I'm so excited to be here to study with you. We Seventh-day Adventist Church believe that our immunity is getting important as the time goes to the end. And so our church is much interested in the way how to live healthily and keep sound body, because the healthy life is deeply related to the healthy Christian life. If you have any question about our church or our church belief, please contact Dr. George or Daniel. So hope you enjoyed this time. Thank you.
Thank you, Pastor Guan, and we really appreciate the church supporting the event. So today, as you all know, we're talking about autoimmune disease. This is a really relevant discussion. Autoimmune disease is increasing quite rapidly. These diseases include psoriasis, eczema, and so forth, rheumatoid arthritis, and a whole host of other medical conditions for which conventional medicine generally only can control symptoms without really addressing the root cause. But there's good evidence right now that suggests that lifestyle habits and behaviors can really impact autoimmune diseases in a powerful way. Today we have 2 speakers who are qualified to speak on the subject, and I'm going to introduce them to you at this time. First, we have Dr. Joyce Choe. Dr. Joyce Choe is a medical doctor. She's an ophthalmologist. She works at various surgery centers in Oregon and Washington. She's a graduate of the Loma Linda University School of Medicine, and she did her fellowship at University of California in San Francisco. She is board certified with the American Board of Ophthalmology. Her own struggles with autoimmune disease launched her into a journey to discover more about how lifestyle factors impact autoimmunity, and this got her really passionate about this subject. So we're really glad that Dr. Choe is with us today. With her as well is Mercy Ballard. Mercy Ballard is Dr. Choe's good friend. Mercy is also a physician trained in Mexico, and she's currently the director for a lifestyle center in California called Years Restored, and where she guides people to make lifestyle changes through her 10-day health immersion program. We're going to get to that a little bit later in the talk. Together, they wrote a book called the Autoimmune Plant-Based Cookbook, and there you have it on the screen. And we'll share with you a little bit more about that later. So Dr. Choe and Mercy, thank you so much for joining us. Welcome to Lifestyle is Medicine Live.
Thanks for having us.
Great. Looks like you're out in the country there. That's really good.
Yeah, we are.
Just to start off with, before we get into like the nitty gritty, so Dr. Choe, so autoimmune disease is really going up, right, these days? It seems like it seems to be a little bit more prevalent.
Yeah, it's kind of hard to know exactly how prevalent it is because it encompasses so many different diseases. And it seems like there's a new autoimmune condition that's being diagnosed all the time. But it's probably like anywhere from 25, I've seen 25 to even 50 million. It depends on which organization you're looking at. But it's in in the 1990s, Stanford did a study where they were trying to assess how much autoimmune disease was affecting Americans, and they judged that it was like 1 out of 36 Americans, and it's probably more like 1 out of 5 now.
Yeah, and it looks like a lot of women in particular, even in my own practice, they seem to be affected by autoimmune diseases. Of course, not only
Yeah.
women are.
Yeah, women do seem to be more affected by autoimmune conditions more predominantly than men. That is true. Yeah.
Right. So, and right now, in terms of conventional medicine, there doesn't seem to be really that many good solutions. As a doctor, can you comment on that?
Well, interestingly enough, actually Mercy works as an infusion nurse for autoimmune patients. So she has even more information on that than I do. Mercy.
Yeah. So what is the question?
Oh, he was asking, what options are there for people with
what
autoimmune
options?
disease?
Okay, in the conventional way, there's several options. Especially we do the IVIG treatment for patients.
IV immunoglobulin.
Immunoglobulin, and it's pretty effective, but it doesn't put you in remission. You have to get every 2 weeks or every month or every 2 weeks, and it's extremely expensive. So, and you still have, patients don't have, it doesn't help them totally, most of them, of the symptoms, so they
How
can still
often
have.
are they getting IG treatment?
So the IG treatment is usually every month. Sometimes it's 3 times for the month, every day for times 3 for every month, or sometimes every day times 5 every month, sometimes just once a month. So some patients have every 2 weeks. And this is, they're had to miss work, and it's a lot.
And the thing you have to know about IG, from what I'm aware of, IG immunoglobulin, this is something that they're collecting from a large number of people. So you are exposing yourself to, risk to the serum of lots of people when you're doing this kind of therapy. And the other kinds of therapies that they have are medications that they're either steroids,
immunosuppressants,
or they're immunosuppressants of other kinds. And some of them are even grown using, what'd you say, like mouse media, or that kind of thing. And so you're having to do all kinds of things to control the immune system conventionally.
Right. Okay. Now, doctor, I want to get to your story, and I'm very intrigued by your story. On your website, you say that in your 20s and 30s, you were struggling with chronic weakness, pain, and fatigue. And then in 2011, you were diagnosed with a certain condition that pretty much seemed to launch you on your journey. Can you just go a little bit into that briefly?
Okay, so for me, I was put on a really powerful antibiotic in my mid-20s. It was called trovafloxacin. It was a medication that was only on the market for 1 year because it caused liver failure and death. And it was a medication that is related to a very commonly used family of medications called fluoroquinolones. And if you go on mission trips, you hear people talking about ciprofloxacin, how they'll take a lot of Cipro and that kind of thing. So this is the same family of medications. And cause issues for connective tissue problems, even psychiatric issues. Some people take it and they have it can do is that it can be a toxin, a poison for the mitochondria. And the mitochondria, they are the power horse of your cells. And so I developed progressive weakness. Over the years, I felt like my shoulders were falling off. It was just I couldn't explain it to anybody. And I never tested positive for anything. Like when I did a neurology test, large muscles were working okay, but it was to the point that I couldn't hang on monkey bars. I couldn't, pick up babies very well. I mean, it was just this progressive weakness and pain, chronic pain. In 2011, after like 20 some years of this, I was diagnosed with leaky gut. And that was by a functional medicine doctor who did some blood testing for, it must have been IgG food sensitivity. And it did help me. But that's how I started my journey of learning about this whole area of leaky gut and autoimmune disease and that type of thing.
So can you explain to our audience what is leaky gut?
So leaky gut, I see you have a picture here. Leaky gut. So your intestinal tract is lined by a layer of cells that is one cell layer thick. So you know how your skin acts as a barrier, but it has many cells on top here. And so your intestinal tract, while it serves as a barrier function for like when you eat food so that you don't have undigested food getting into the body, you don't have bacteria and viruses that shouldn't get into the body getting in. If you have damage to that intestinal tract, it can cause this condition of leaky gut where you now have undigested food possibly getting in. You have these viruses, bacteria, toxins, and these types of things. And we call that leaky gut or gut permeability.
Right. And I think a lot of people don't realize how vulnerable the gut actually is. As you mentioned, it's only one cell layer thick, and it's really important to keep that wall tight.
Exactly. And the thing is that I didn't even know that I had any abdominal or digestive issues because I didn't feel I had digestive pain. I think or abdominal pain, because number one, I think we get used to not feeling good and it just becomes our status quo and we're just, we just accept it all. And I never thought I had a problem there. I thought I could eat anything.
Right. And so you mentioned leaky gut and like stuff going into your like undigested food particles or even bacteria getting past that barrier into the body. So what's wrong with that though? Can you explain?
Well, it causes inflammation. That's the short story, is that it causes inflammation. The way that it does so can be by various mechanisms, but something that can happen when this occurs is that number one, you may have some kind of what they call mimicry happening, which is where when your body sees that substance that shouldn't be in the body, it will try to attack it. It'll try to do its job and get rid of it. And sometimes it gets confused. It might start attacking something in the body that looks like that undigested food particle or something like that. So that is one way that someone could develop the autoimmune condition. Dr. Alessio Fasano is a researcher at Harvard, and his laboratory discovered zonulin, which is a protein that is released by the body when you eat wheat or gluten. And so when this happens, the zonulin attaches to zonulin receptors on those intestinal cells. And they will cause your intestinal cells to lose the tight junctions between them. And those tight junctions are little interlocking things that allow for, right there, for you not to have penetration of those undigested food particles and that kind of thing. And so zonulin is a protein that, you eat it, it attaches to receptors, and it'll just open up those doors. And now you have a leaky gut in that way. The other thing that having leaky gut will do is that the inflammation that is caused can cause damage to the intestinal tract. So those intestinal cells will then suffer their own injury and you won't be able to absorb. And so that's why people who have this problem will develop malabsorption. Their bowel movements will look abnormal. They'll be sticky, stinky, that kind of thing. Or they'll develop anemia, which is a very common presenting symptom that a lot of people have. A lot of people are developing anemia and they don't know why.
So let's get now into nitty gritty. So you were struggling with this, and so what did you do, and what works for autoimmunity in terms of let's start with nutrition, and what did you do, and what was going to help with like leaky gut? What's going to keep those tight junctions intact and prevent leaky gut?
Okay, so what did I do? I did an elimination diet where I got rid of a lot of the food on that whole list of foods that I was sensitive to. And I learned about, and I was sensitive to even foods that are good for you. Like I was sensitive to bananas and pineapples and that kind of thing. And I got rid of corn and soy. What I had a problem with was when I tried to reincorporate food into my diet in around 2015, I started trying to eat corn and I started trying to eat soy. And I found that I started developing, you know, like chronic sinus issues. I was having difficulty breathing. I was having gastric reflux at night. And around that time was when I found out about a lifestyle center called Years Restored, where they help people to learn how to recover using a plant-based diet. And so in 2016, January of 2016, I came here to Years Restored in California, where my friend Mercy is. And she has a lifestyle center. She has her own story. She developed celiac and arthritis and had her own journey of trying to figure out this whole food sensitivity thing, and then started her own lifestyle center here.
Let's backtrack a little bit. You said elimination diet. So what is an elimination diet? And my next question is, you're saying plant-based, so why plant-based?
Okay, those are good questions. So an elimination diet is basically where it depends on who you're following, but what we do is that we eliminate the foods that are most commonly associated with leaky gut. And we think that nowadays it's gluten, just because the way that wheat has been engineered since the 1960s, 70s, it was engineered so that one plant would produce about 10 times as much wheat as the original plants used to. And it seems to have changed the wheat. And so gluten seems to be a real problem for a lot of people. We also teach people to avoid foods that are high risk, genetically modified. And those would be foods like soy. Soy is over 90% genetically modified. Corn is over 90% genetically modified. And so whatever things that are high risk, genetically modified, we teach people to avoid those things.
So
And then
try to go organic as much as possible, or
exactly, we try to teach people to avoid other toxins. And even if it's not genetically modified, for instance, genetically modified just means that that plant has been bred so that it will be able to withstand Roundup. So you can spray tons of Roundup on it and it will just collect all that Roundup and give it to you once you eat it. So you're eating high levels of glyphosate, which is the active ingredient of Roundup. So what we're finding is that it's not only genetically modified, it's also when you're eating foods that have glyphosate in it. And unfortunately, much of our food is being sprayed with glyphosate. Many of our grains, many of our beans, even fruits and vegetables can have glyphosate residues. Mm-hmm. And glyphosate is a mineral chelator. It's an antibiotic as well as an herbicide. And so all of those effects, we're getting our minerals chelated. We're having an effect on the microbiome. And, you know, all of this is affecting our human health.
Right. So if they get a list of these common food sensitivities and they eliminate them, how long do they eliminate them for? And what should they expect as they eliminate?
Okay, so you know, it's not just this genetically modified like the corn and the soy. Also can be other foods, like for example oats lately, perhaps because of the spreading with glyphosate. So oats is the in the last perhaps 3 years, more people are sensitive to that. So you know, people that come to our center, they're plant-based and they're very healthy, and then I ask them, what do you eat for breakfast? Oats. Well, oats
Every day.
every morning. So because they're spraying with glyphosate, it's not genetically modified food per se, but it is spreaded. So people get are super sick also. Another thing that's happening also is the yeast. The people are showing more and more sensitivity to yeast. So what we tell people is to, you know, test yourself. There's a lab that we like and send them to test, and then they realize, you know, oh yeah, you know, I'm eating a lot of that, things like that. So for how long? The question is for how long you stop eating. So when you test positive for a food that is linked to protein, we tell them, you know, you just have to avoid those foods for life. Not avoid, just stop eating those. So let's say if you test positive for gluten, for oats, yeast, gluten, with soy, with this, we said, okay, those are the foods you have to eliminate for life, because you know the immune system has some memory cells, right? So when you try to reintroduce those foods, you're gonna start, you know, having symptoms again. So that's what we noticed with the people that come here. So we have to eat foods that are not, you know, we have to learn to eat other type of foods. So we introduce them with the pseudo grains. We
like buckwheat, amaranth, and quinoa. So we just teach people how to eat differently to avoid these foods, because it's kind of like with diabetes. You can go into remission with diabetes, right? But you can't go back to the way you used to eat. And so it's kind of like that with this, and that, like, yeah, you can heal the leaky gut, but you can't go back to the diet that caused the leaky gut.
Mm-hmm. And then we reintroduce
yeah, just to
we go ahead.
Just to clarify, it's only those foods that you test positive to, right, that you should eliminate for life? Or should everyone?
Exactly. Okay. Not just the foods that are linked to proteins that you're positive. Those are the ones that we don't reintroduce. But there is we also, what we do in the 2 to 4 first months when you're in the program, we eliminate grains and nuts. So instead nuts, we use sunflower seeds and pumpkin seeds. And for the grains, instead using grains, we use the pseudo grains. But this is for a time. So after people have no longer symptoms, which is usually takes 2 to 4 months, there we have them reintroduce grains, but in a healthy way. So the grains will be, for example, teff, rice. If they're native with oats, they go back to oats. There is sorghum, another grain that's tasty, really good, that is called sorghum. And then all these pseudo grains. So people start eating even with more variety, so they don't miss, you know, these few, even though that they're staple foods, but they're only, right? So then the nuts, we start reintroduce them after the symptoms are gone.
We also, to heal the gut, what we do is we soak and we sprout a lot of these foods, like anything that's a nut, seed, grain, or bean, or legume. We soak we soak them. Some of them we actually go ahead and sprout them, and that'll help with decreasing what we call anti-nutrients, like lectins, things that can bind to the intestinal tract and cause injury, or decrease nutrient bioavailability. And so this we found to be very helpful as far as making food more digestible and improving healing time. And
you both mentioned plant-based, so why plant-based? So why cut out the animal foods?
That is a really good,
we love that question. Yeah.
So both of us found that when we started on this journey, even though we believed in plant-based and we'd gone to lifestyle programs and that kind of thing, when it came to the autoimmune and the leaky gut community, there were many people who said that you could not recover using a plant-based diet. and that you had to adopt a paleo diet and incorporate things like bone broth and that kind of thing. And if you look at autoimmune lifestyle online, you will find that that is the most popular diet and lifestyle, and it's considered to be most scientific.
Yeah.
The reason that we wanted to do this is because we believe that plant-based, there's scientific evidence for it, that it is least inflammatory, and that it is going to provide the most nutrients and that type of thing. But we do have to answer the question why it's not working for everybody. And because there are a lot of people who are on a plant-based diet who are not improving. And so that is why we have to look at things like what's happening in agriculture, what's happening in medical care or healthcare. You know, why is it that so many young people, children, are having leaky gut issues? And you know, I think that this whole issue with the industrialized agriculture, with toxins, with all these medications, with mandated healthcare being imposed upon a lot of children and pregnant women and that type of thing, that there is what we call an epigenetic effect, where generations upon generations, our digestive systems, our health is being impacted.
Also, with the why plant-based and not meat, you know, the meat is related to the, you know, bad bacteria or the unhealthy bacteria, pathogenic bacteria, and the plant-based is related to the good bacteria, to the beneficial bacteria. I think you were showing a picture there that it was good. You know what happened with this, you know, gram-negative bacteria, and they have this layer. I saw a picture you were showing.
Gram-negative bacteria have one of the most powerful toxins called lipopolysaccharide, and you will find high levels of that in you know, animal products, and you cannot cook it out.
Yeah, not even high temperatures. It can go even to cross the membrane barrier of the brain, and you cannot destroy it. So it destroys even your brain. So for us, plant-based do it in the right way for autoimmune people. It works like an amazing way, because even doesn't even take that long, because what we do is we fix the microbiome. So we load them with tons of plant-based, full of fiber, and a lot of fresh foods, because the fresh foods are bacteria, you know, if you have from your gardens, and also they're prebiotic foods that are going to feed the good bacteria. So you eliminating the inflammatory foods, which is one of them is meats, and then the inflammation is going to decrease. And then you have to have a good balance, plant-based also, to decrease the inflammation. And we eat the super healing foods too, right?
So yeah, we teach people not just, you know, plant-based, but we teach them how to eat. You know, we basically, if you look at our cookbook, the 7-day meal plan is divided up into 2 meals. It's breakfast and lunch. We don't provide dinner, and that way they get the benefits of fasting their 3rd meal, which is intermittent fasting. And so they get time for people to rest every day for about 16 hours. And that helps with the whole healing thing. In the cookbook, we teach you how to eat, all the principles of that. And because it's not just what you eat, it's also how you eat. And so we teach people about that as well.
And with people that have very serious issues with autoimmunity, with serious issues digesting, because there's people that have this chronic diarrhea, chronic nausea, you know, a lot of pain usually. So people that have been sick for a long time, we tell them you're gonna have to sprout your seeds, not just soak them, sprout it, and that had make the big difference. So for example, they start soaking a night before, the next morning they start sprouting them, and the next night you can have the little tails. So once they have the little tails, you know, your legumes, they can be cooked. And also you can soak your sunflower seeds, your pumpkin seeds till and sprouting until you see little tails. So that's super helpful. and your your pseudograins, we had them also sprouted, and that made a huge difference.
And that's what we do probably differently than other programs. Like, I think other programs, number one, they aren't going to be so consistent. So like for us, you know, even if you're eating bread, like if you go and eat a gluten-free bread from the store, they might have great ingredients, but they haven't soaked or sprouted their ingredients prior to making the bread. And we teach you how to do that. So we do everything that's from scratch, which does take longer, but we teach you how to adopt that lifestyle. And then the other thing that we do is that oh, now I had a brain fog.
It's okay. So yeah, it's very important to be very detailed, because we said 2 to 4 months, but if you fail, let's say that one day you went and just test a piece of you know, bread, then you have started your 2 to 4 months again, because then you develop this autoimmunity attack.
Well, what people may not realize, sometimes they're like, okay, I've been good for like 2 weeks and now I'm going to give myself a treat. And then they go, you know, celebrate with something that's not so good for them. And they will find that they fall possibly even harder than they did the first time. And it gets even harder for you to recover. And so I would highly recommend, when you start on this journey, that you commit to it. If you see yourself improving, keep on going. Don't slow down. And if you find that you're not, don't give up on it. You know, you want to find what works for you. Every single thing that we write in the book may not work for you. You might have to tweak things a little bit, but the principles are there.
So, you know, I'm glad that you brought that up, because when we tell our patients to go on an elimination diet, we tell them that they have to stick with the program, else it kind of messes things up. So when people want to do the elimination diet, they have to really stick with it. And also,
They do.
yes, also I've seen with even my own patients, like for example, when people have rheumatoid arthritis, when they switch to plant-based, it's remarkable the benefits or the improvements that they can see. So I'm glad that you're mentioning that.
And Dr. Choe, this is the thing. It's like, I think people associate autoimmune and leaky gut with some of these things like rheumatoid and just these conditions that are more traditionally autoimmune. But we're finding that all kinds of chronic illnesses are or can be associated with food sensitivities. And even something like heart failure, for instance, can be associated with food sensitivities. And so many different conditions. I think if you have a chronic illness, you're going to have a leaky gut issue. And
yeah, because it can attack any organ, right? We have it can attack the liver, the kidneys, also the heart, the brain. So it can, destroy any organ. And usually it's multi, but it can attack factorial or in multi organs.
Oh yeah, if you have one problem, you usually will end up having another too. It's not like, it seems like illness likes to have company.
Yeah.
It reminds me, Hippocrates, the father of medicine, he said all disease begins in the gut. I guess that's kind of what you're talking about.
Yes. And the thing is, 70% at least of your immune system is in the digestive system. And I don't know if you found this, but something that was off, or it was sugary, or even overeating a meal that I didn't need, I would start getting sick afterwards. And so I found that even for developing a cold, an upper respiratory tract infection, people don't tend to put the two things together, but a lot of times if you improve your digestive system, you're going to be much less susceptible to developing infections and that kind of thing.
Very interesting. So you said that like 70% of your immune system is located in the gut. I don't think a lot of people realize that.
I know, I don't think they do either. And so I don't think when people eat, they tend to eat just for like the experience and what the food looks like and what the food tastes like and how it makes them feel. And they're not thinking about how it is I protect this very important part of my body.
Right. And even with the COVID-19, they're finding that the SARS-CoV-2 virus can actually bind to receptors in the gut as well. And so people are
That's interesting. Yeah.
diarrhea and things like that. So again, it seems like the gut is
Yes. Right, right. The gut is so important, and it is so, everything is so interrelated, you know. And so if people understood that, I think we'd be much kinder to ourselves than we are.
that's right.
Especially this time. I was gonna say, especially these times that we're dealing with COVID-19, we have to treat ourselves. We have to take care of ourselves the best possible.
Yes.
So then we have to eat the best foods. We have to have the best balance. We have to remove all the inflammatory foods, remove all these genetic modified foods that are really destroying our system. So more than ever, these principles are so important.
Yeah,
Great.
I think we need to make a statement that we believe in this kind of stuff, because when we continue to consume these foods that are made poorly and unhealthfully, we're basically saying, I accept what you're doing. And so I think for us to stand up and say, it is not something that we're going to tolerate for you to be selling us food that it causes death, even if it's slow death.
So before we move on to possibly discussing supplements, and then we'll go to questions. So what I'm hearing, to summarize, is that we should be going plant-based, and then, but even among plant-based, we should be trying to go as non-GMO as possible. And even among plant-based foods, there might be some foods that we're still sensitive to, and we should eliminate those. Is that
Yes.
a good summary?
Yes.
Excellent.
And the foods that are not so high in protein, you might be able to get back into the system better. Like, you know, say that I'm sensitive to tomatoes one day, you know, I mean, that can change possibly. Those kinds of foods can change.
Yeah, usually the foods that the nightshades, you can reintroduce them after the leaky gut problem is solved. Usually the people do good. And all the other vegetables that they couldn't tolerate, they will be able to tolerate after the leaky gut issue is solved.
Usually, but
Yeah.
there are certain foods
Yeah.
that you still can't,
Yeah.
you know, sometimes.
Right. And just before we move on, Dr. Choe, can you list some of the common food sensitivities that you often encounter, just very quickly?
Well, interestingly, it's like nightshades do tend to be an issue. Gluten tends to be an issue for a lot of people. Soy tends to be an issue. As Mercy says, yeast. We've gotten people off of a lot of oats lately, as she was mentioning, because of the whole glyphosate issue, possibly. I'll tell you, I've been sensitive to things like melons and, you know, potatoes and peppers and all these great foods that I've had sensitivities to, but it's not consistent. Some of these foods I'll be sensitive to for a while, and then I'll be able to reincorporate it. And it all depends on the day, the year, the month. And so you just kind of have to be flexible.
Right. Maybe we should all grow our own food. I guess that's be a good thing.
You know, that's what we're trying to do. I mean, Mercy lives out here on like 40 acres. What do you live on? Like 20 acres or something. And I just moved out into the country too. And I'm really trying to do that as well. So
Yeah, it's very important. Even if you don't have a big country place, you can just plant your herbs in pots, right?
on a deck or
On
on
a
a
deck,
windowsill.
wherever it was, because these herbs are gonna be having a big impact in your microbiome, because you're gonna eat these microbes that are super important to balance your microbiome and decrease inflammation.
Yes, and when you're eating those plant-based foods, you get fiber, and that fiber is what your intestinal cells love. And so, you know, you're not going to get that from animal foods. And so that's another reason to be eating plant-based.
Right. Well, before we close up our discussion, you know, I went to your website and found this quote on your website. I want you to comment on. So it says here, my conventional training caused me to receive my diagnosis with a healthy dose of skepticism and doubt. And that's when you receive the diagnosis that you have leaky gut. And so
Exactly.
my question to you is, you know, there might be people listening and they're thinking, you know, what you're saying makes sense, but now they have to confront their doctor, like their medical doctor, and that medical doctor might be like you were in 2011. So
Yeah.
for you might have that question, what would be a good way to kind of have this conversation with their medical doctor?
That's a good question. You know, that's hard because like I have not been to a doctor myself in a few years because I faced that. The last time I went to the doctor and I told them I'm having these issues and I'd like to have a referral to a rheumatologist because I was like, I really would like to get a diagnosis of some sort, something. And just the treatment that I got, it was so hard on me. I just didn't have the heart to go back for a while. But there are doctors out there. I would maybe start by asking around, asking friends who they are seeing, find out, maybe there are people either in the conventional world or in naturopath or that kind of thing who can help you on this journey. And I would start out having kind of low expectations. I would try not to expect my doctor to always be on board with me. And I look at a doctor as someone who can help you get testing, who can help you maybe find out the results of those tests. But then you just have to be willing to be flexible and keep on looking around. That's been my journey. It's hard to find.
I guess part of lifestyle medicine is the patient taking ownership of their own health. I think that's one of the powerful things of lifestyle medicine.
That is true. I mean, that's why, I mean, I'm an ophthalmologist. I'm not here, talking about my my specialty and but I feel like I have a good understanding of nutrition. I have a good understanding of how the body works, and I have my own experience. And so I thought, I probably could help people to share my journey, help share Mercy's journey.
Mm-hmm. All right.
And you were asking about supplements.
Well, I think we'll get to the questions and maybe that'll come up. But we have to get to the questions.
Okay.
Okay, yeah.
Okay.
So we have a question from, and sorry if we'll say the name and then we'll just ask the question. So Amni, he asked the question, what is the main test for leaky gut and how do they diagnose it?
There are a lot of different tests that they can do for leaky gut. I think that most people will tend to do food sensitivity testing because that tends to be one of the outcomes of having leaky gut. And so that's why people probably just go in that direction instead of some of these other tests, these functional tests to see if you have leaky gut or not. So food sensitivity testing they can do with blood testing, and that would be with IgG, which is what we call delayed hypersensitivity testing, meaning that it's not an allergy test, which is testing for IgE. It's a test that shows up, well, these food sensitivities can show up within, immediately. It can be within hours or it can be within days. And so they're testing IgG. We like the IgA test with stool that Interolab does, just because that IgA test that they do, so IgA is something that when they're looking for celiac disease, they will look at blood. But IgA is not and so we believe that doing it in the stool where it's produced most prolifically, that it would be more sensitive there. And there's some indication that might be true.
In myself, I had they did a blood test and it showed negative. So when they do a stool test, it was positive. So, and that really helped me because when I eliminate those foods that I wasn't sensitive to, then I start improving. So that means that, the blood, it wasn't as accurate.
So some people think, well, this IgA testing with the stool, it's too sensitive and they don't want to be sensitive to these foods. But what Mercy is saying is just try it. Just try what those, eating according to the results of those lab tests and see if it works for you.
We have another question. So the question is, from Alicia, and she's asking, isn't avocados and watermelon and squash GMO? A lot of fruits and veggies are GMO. So maybe we could phrase the question like, are there certain fruits and vegetables that people should be aware of that might be very genetically modified? Like just a few and very quickly.
Yeah, so those foods are not as commonly genetically modified as we're aware of. It's more things like what we mentioned, the soy, the corn, papayas. zucchini is starting to become more genetically
Apples,
modified.
I think.
Are apples?
Apples, they're starting to, not all over, but yeah, there were plans to do that.
If you're looking at supplements, for instance, like enzymes and you know, a lot of these animal products, they will tend to be genetically modified. Let's see, alfalfa, highly genetically modified. I can't remember now, but those are the main ones that I can think of.
Okay, we have another question from Davey. So if you recover from autoimmune disorder, or maybe you're controlling it very well, the question is, can I once in a blue moon have a meal at a restaurant without having reoccurrence of symptoms?
It hasn't worked for me yet.
You know, you have to be very careful. I think there's restaurants that are healthy. Some, you know, claim that they have a lot of organic foods. You can go to the health food stores where they have foods that are organic. So you can choose, you know, they have a buffet there. So you can choose your beans and your guacamole and your salads.
You do
like
have
that.
to be careful with the beans. Last time I went to a restaurant, they served beans because they didn't soak and sprout. I suffered for days after that. And so even if it was an organic restaurant, I would probably try to choose something more in the salad section, and maybe a bean that wasn't so vital that it be soaked. Like sometimes lentils you can get away with and that type of thing. So yeah.
We have another question from Allison.
Sorry, David.
Sorry, baby.
Yeah, we have another question from Allison. Do you avoid corn, soy, and wheat completely, or just if they are GMO? So what if they are not GMO? Are they okay?
That's a great question. You know, if you were not exposed and build up those antibodies, you can eat those foods, even wheat. But if you test positive and you build those antibodies, then your body's gonna react even if you do the organic. So that's a tricky thing. So like, for example, myself, I was positive to not oats, but soy, corn, and gluten. So I don't eat it because if I eat it, I get sick. One time I did eat corn. I went to Peru. I'm from Peru. Went to Peru and had corn because they have these super tasty corns. And I got my pain on my joints. I had arthritis pain again that lasted for a long time. So I don't risk it. I don't eat those foods.
Most of us with autoimmune probably will test positive.
Right. Okay. And I guess this is something similar. So DCV is asking a question. How about gluten-free oats? So you had mentioned that oats could possibly like there's gonna be cross-contamination there. So how about gluten-free oats for gluten sensitivity?
If you are negative in the test, we say, yeah, they have to be gluten-free and organic. But if you test positive, you most likely is gonna have your symptoms back.
Okay.
Yeah, and the thing about like eating non-GMO soy and non-GMO corn is this. You have non-GMO corn growing next to GMO corn and nobody knows. And there's all kinds of cross-contamination and you know, if you're most people don't do this until they get sick enough to the point that they're wanting to do something more, you know. And so, and if you're sick enough that you're wanting to do this, we would not recommend that you risk it.
Right. Okay. Now we have a very intriguing question here. This is from Davey. Do you have any advice for maintaining this diet if you're someone who travels very frequently and eating vegan and gluten-free is more difficult?
Sure, definitely. We do travel a lot together to, you know, lately it was like a lot of traveling we're doing because we do lecturing.
Well, not with the COVID, but
yeah, we were doing the past. So we take our food. So
we pack food. So what Mercy does is that she will she'll cook everything and then she will dry freeze it. She has a dry freezer, and or you can just dehydrate and take some dried. I will go, once we get to the place, I will go and buy all the fresh produce stuff. And then usually we have a hotel room that has a refrigerator, and we bring a little cook thing, a little slow cooker. And, you know, we buy little things to to chop things up on and stuff like that. And so we just it takes a little bit of doing.
But if you don't have a dry freeze, right, because it's very expensive, not many people have it. So what we do, we take our legumes, everything, our pseudo grains, and we soak them a night before, and the next day we cook them. So, you know, we're used to this, and it's kind of fun, actually. We invite people to come with us, and we prepare. We definitely had to prepare for it.
It's much easier when you are doing it with somebody
else. You know, I bring bread. I make bread, waffles, butter, cheese, all that. So you know, we have a feast, right?
But even if you're by yourself, if you're committed to doing it, you can do it. You know, maybe one of those days you consider to be like a, you know, more of a fast type of day. And I eat much more simply, but it is possible to do. I mean, when you get to this point, like when I came here to the Lifestyle Center my first time in 2016, and I came in with pain, I was having difficulties breathing at night when I went to sleep, and I woke up on the third day and I didn't have pain, and I hadn't had difficulty breathing at night. And it was just, for me, and so I would rather do all of this and stay pain-free and be, you know, have my quality of life than to eat whatever comes to my way and suffer.
Right. Okay. Maybe last few questions here. So let's talk about supplements. So now, of course, I appreciate that there's gonna be different supplements and different things for different conditions. So, but just very briefly, people who have autoimmune diseases, should they consider taking some supplements or no, or just lifestyle?
That's a good question. You know, we love doing juicing as a supplement. So people that have been really sick for a long time, we say, oh, 30 minutes before meals. But if they, for example, if it's winter and the vitamin D is really depleted, then we're gonna say, yeah, go ahead, take your vitamin D. Find a super good source that is organic. Perhaps it's a liquid, like doesn't have a binders, and because it can have some stuff that you can react to it. So you have to be very careful also what supplements do you take. Also with the B12, if it's really low, then we're gonna say, go ahead and take it and find a good source of B12.
Yeah, I would get those levels checked. We don't have supplement recommendations. And, you know, when people come here, we don't work with them from a health professional point of view. We have them work with their doctors and that kind of thing. And so what we're trying to do is we try to help them optimize their lifestyle the very best. So this is the most anti-inflammatory diet they can be on. When they come, they get time out in the sun every day. They get some time to go walking. They get some time for the sauna. So we are doing everything that we can do to optimize the lifestyle. Your ingredients. You want to look at what is making up the capsule. Is it a gelatin capsule? Is it a cellulose capsule? What else is inside? Is it silica? Is it, you know, what are the things that are in your supplements? And I really, you know, I used to take lots of supplements, and I really I can't answer for everybody because I'm still on my own journey, and I struggle with it myself, but I really try to minimize supplements.
Okay. Last question here from JK. Do you have cheat days? And if so, what do you have?
Do you have cheat days? Well, okay, so JK, I think, you know, when I was first starting out, I might have thought of cheat days and that kind of thing, but cheat days make me feel so bad. The last time I went to a Thai restaurant, because I took a girlfriend out there a couple of years ago, and by the time I got home, you know, I could hear myself breathing. And so for me to do that, it's just not worth it. I feel so much better. Like, I love this food. I love how it makes me feel. I love coming to Mercy's place and eating this way and feeling great. I mean, I don't even think about having a cheat day. I guess that's the thing. I don't think about it.
Sometimes, you know, at lunch you feel having some treat, right, after lunch. So what I do, I just grab a waffle that I have frozen waffle that I made earlier, and just grab it and put a little of my butter that we make our own from seeds. And that is a treat for me. So that'll be my treat.
But she does make really good pies.
Yeah, we do pies. We also have
we
couple
do little
recipes for
desserts here and there and that kind of thing, and they are really, really yummy. And but I don't know, I think that when we get enough minerals and other things with the food, that you don't have those cravings. That must be it, you know, because I don't have really the cravings.
Right. Well, thank you, Dr. Choe, and thank you, Mercy, for sharing with us and taking your time to be with us. For those of you who want to learn more, there's the website right there, drjoycechoe.com, and Mercy Ballard's Lhasa Center is yearsrestored.com. Also, their book, you can get it at this website here, wholenessmarket.com. It's a plant-based autoimmune cookbook. We also want to just thank our sponsors again. So the Seventh-day Adventist Church, we really want to thank them for being participants in this. We really appreciate that. And also Pathways to Wholeness Lifestyle Medicine Clinic. If you want to learn more about some of the testing and stuff that we just talked about, you can go to there as well. It services the Toronto area. And Lifestyle is Medicine for putting on these webinars. Before you go, we also want to let you know about our next upcoming webinar is on cancer and how plant-based nutrition can help with cancer. It's going to be this Sunday at 4 o'clock Eastern time. And we'll be talking with a radiation oncologist and also a registered dietitian about plant-based nutrition and how it affects cancer. So Dr. Choe and Mercy, thank you so much again. And for all of you who are here, thank you so much for taking your evening to be with us. And for those of you who ask questions, thanks so much for the questions. They're very insightful. So good evening, everyone, and hope you are blessed, and take care.
Thank you for inviting us.
Thank you.